Ladies and gentlemen of the media and those persons joining us on social media, we want to say thank you very much for your patience. Welcome to this first conference of the... Are you hearing me? Right. The first conference is Pncr. My name is Randolph Critchell. I'll be your moderator for this very important first conference. We have on the panel today, to my extreme right, Dr. Van West Charles, and to my immediate right, Dr. Karen Cummins, both PNC executive members, and they will be taking your questions. We will start, of course, by allowing Dr. Cummins to read a press statement, and then we'll go into questions from the media house. The usual protocols being established. Just say where you're from and your questions. Of course, you can use the raise hand feature, or you can type your questions in also. Without any further ado, let me allow Dr. Cummins to read the press statement for today.
Thank you very much, Randy, Mr. Critchlow. Good afternoon, fellow Guyanese. The People National Congress Reform wishes to inform its members and the Guyanese public here and abroad that the party's Central Executive Committee at its most recent meeting held yesterday, Wednesday, September 23, 2021, decided on the members of its Congress subcommittees and resolved critical issues of membership. The party is well on its way to holding its 21st Biennial Delegates Congress on or before December 13, 2021. The People's National Congress Reform expresses grave concern that the COVID-19 pandemic is being totally mishandled by the government. The actions of the government are causing more deaths, more infections, and more hospitalizations of our citizens. This is due primarily to its abandonment of the coalition's effective COVID-19 plan that it inherited, and its determination not to have any bipartisan approach to managing this pandemic. Guyana, being now classified with the highest restriction on travel, Tier 4, as announced by the Center for Disease Control of the United States of America. This also means that Guyana is classified as having the highest level of mismanagement of the COVID-19 pandemic. We are calling on Minister Frank Anthony to step aside if he cannot provide details and specific information to the following questions for the Guyanese public. How many free PCR testing sites are there in Guyana, and where are they located? What are the variants of the COVID-19 present in Guyana? What is the infection rate among our citizens? How many vaccinated persons have died from COVID-19? How many children there are and have been infected with COVID-19 and would have died? How many AstraZeneca, Pfizer, and Sputnik V vaccines have been received to date? And how many persons have received first dose and the second doses? Is there a national register for the collection of data on adverse effects from the vaccine? How many persons who have underlying conditions receive vaccinations? Where can persons with underlying conditions receive an exemption certificate from being vaccinated? How many ICU beds are there? And how many trained ICU nurses are employed? Comrades all, the PNCR calls on this government, once again, to take politics out of health and have a national, multi-stakeholder approach that would result in no deaths, less infections, and less hospitalizations. I thank you.
Thank you, Dr. Cummins. Now to the members of the media who may have questions, we can now direct your questions to both Dr. Cummins or Dr. Van West Charles on the statement I can hear you.
If I may, Nazima Rakiya from News. Do you hear me?
Yes, go ahead, Nazima.
I know Dr. Charles didn't make a statement, but I'd like to ask you a question, if I may. Yesterday we had 362 cases recorded. There has been talk about the variant being in Guyana with no proper confirmation. But I don't know if you've been monitoring the numbers. Most of them for the past couple of days, at least in September, has been about 270 to 290 thereabouts, and yesterday 62. What does the number say to you? Experiencer, that's why I'm asking you.
Okay, so obviously there appears to be an increase. And for some time, the Pncr, in particular, together with the opposition, APNU AFC, has been calling for genomic sequencing of so that we know which variants are circulating in the country. Presently, we are just getting wild and general statements. And it is important, as per the question which Dr. Cummins just read, that the government should be very, very clear in saying to the populace which variants are circulating in Guyana and which variants are circulating in which regions of Guyana. That is very important because the transmissibility of the Delta variant is very high, and we need to have this data in terms of the management of the program.
Sorry, if I could have a quick follow-up, sir. A bit of what's happening in the region and around the world. Is a lockdown necessary at this time? I know it has been something that we have asked about in the past, but based on what you're seeing, is a lockdown necessary?
To my mind, in a country like Guyana, it is not necessary if the program is managed properly and there is adherence to the public health guidelines and they are monitored. There is a system of monitoring together with the vaccination. And that is monitoring in both the private and the public sector. If this cannot be done, then the lockdown and serious curfew arrangements need to be put in place. So that is why we are saying that it is important, and we understand the impact, the economic impact that it would have on businesses, etc. But it requires a different approach, an inclusive approach, and the government's resistance should go away, and let us proceed with some of the plans which they inherited. Things may have changed some degree, but that is very, very critical at this point in time.
Thank you, Dr. Valens Charles. You recognize News Talk Radio and then Wendell Badgery.
Adam Harris.
Okay.
Dr. Cummins, Dr. Vander, Harris.
Okay, Adam. Well, we'll take Adam and then we'll go to News Talk. Thank you. Go ahead, Adam.
Yeah. Not long ago, there were statistics that suggested that about 60% of the population is either diabetic, hypertensive, or both, which would suggest that some 60% of the population will have underlying conditions. I don't know if you have those figures, but given the case, if that is so, you are insisting on vaccination. If anything happens to this 60%, they die, for example, after vaccination, you're going to say they have underlying conditions. Why this big rush for vaccination?
Yeah, or Dr. Cummings?
Okay, thank you for the question, Adam. As you rightly said, Guyana, we have about 60 to 70% of our persons who would have gone to our health facilities, be it the tier 3, of course you know health is decentralized, so be it at the health post or the health center or the regional hospital, would have come down with diabetes or some chronic disease. So indeed, even before COVID, we already know that 70% of our population, those who have come to our clinics, would have been treated for chronic disease. So we know this upfront. And so it just goes back to show the poor planning. There is no comprehensive planning. There's no stakeholders involvement. So we can work this thing out. It's doable. And if I'm to take the moot from the director of the WHO, who says that this COVID has put us it has given us an opportunity for us to work together, both governments and other stakeholders, opposition leaders, so that we can really contain this virus. And it's so sad that as my partner says here, Dr. Van der Charles, that they had gotten a good wicket. We left a good plan, national action plan that they could have run with. And so to answer your question directly, there will always be a subset of persons who are unable to take the vaccines. And we know that. And those who are vaccinated, it's no secret now that persons have gotten breakthrough infections, whereby especially those who are over 65, those who are immunocompromised on immunosuppressant drugs and so forth. So there are persons who would have not fit the bill of being vaccinated. And so it just goes back to show that Minister Anthony, I don't want to use the term mendacious propaganda, but he seems to be speaking untrue. And so we're asking him to step aside, to move aside and let persons who know to run the country, who know to run health, to take the helm. That's what we're saying in short. And that's our reason for this press conference.
Thank you.
If I may,
Go ahead.
Adam, just quickly, vaccinations provide health benefits to those who have chronic conditions such as diabetes and hypertension. So it is not to say that those who have diabetes and hypertension should not be vaccinated. But I would agree with Dr. Cummins that Dr. Anthony has been so general and evasive, and this is for this reason why we are saying that he either steps up or steps aside, because this is a serious matter. I agree that the cases are escalating, but we cannot continue as a responsible political party to witness the uninformed nature by which Dr. Anthony is answering questions when posed to him with no specificity. And when we are talking about the variants, he doesn't know, it may be so or whatever. So those are unacceptable. And if he is serious about the issue, and the ministry is serious and the government is serious, he either provides the answers to the population as we see in every other country around this world, and it is important that they do so that the citizens can make their right decisions. And if he cannot do that, he must step aside with some immediacy.
Thank you, Doc. News Talk Radio.
Dr. Van der Straus, assuming that the Delta variant is prevalent in Guyana, what then would you recommend as far as management of the virus is concerned?
Well, if we make that assumption, then one of the things which is important is an approach which brings together the adherence to the public health guidelines, a revisit of the opening of schools to ensure that the school's environment is safe, and the offices where we work in both the private and sector and public sector are safe, and that we try to reduce the vaccine hesitancy and increase vaccination. But we do have a problem of trust by the population, and that is why the vaccine hesitancy continues to plague us, because the government resists an inclusive approach, resists a transparent approach. It's basically asking for basic information which should be available to us. If you go to any other country and you go to their websites, you can find a lot, and it's important for the management of the program. So that is what we have to do. Plus, I think it is important for on the treatment side that the physicians who are involved ensure that they are following the updates in terms of the management of patients. And then the other thing is to look at, I haven't been able to look at the hospital in terms of its management inside, but you've seen pictures which are concerned for us, and therefore we need to ensure that if we are having a degree of overcrowding, the government needs to look at other facilities and to plan for an expansion with respect to care for the many people.
Thank you. We recognize when go ahead, Dennis.
Doctor, when one looks at the way the virus has been, for want of a better word, behaving across the Caribbean, one sees escalating numbers in almost every country. In fact, there's a pileup of dead bodies in Grenada, even looking for refrigerated trucks to put the bodies. To what extent would you say that the situation really is no different from any other from any other Caribbean country, and it's basically how the virus is behaving and not necessarily the management of the situation?
No, it's not you can't place that on the behavior of the virus singularly. It has to do with the management of the program, as you've seen in New York, in terms of the management at the healthcare facilities. And so it has to do with how the program is being managed and how the different analyses, and that's why we're saying Dr. Frank Anthony has to take a more serious approach with his advisors and ensure that we are clear what is going on. The whole program is a black box, and we have Guyanese here and in the diaspora can make a contribution to what is going on in the management of this program, and they need to just relax and include people who can work with them to make this thing come under control.
Thank you, Dennis. We recognize Wendell Badri.
Hi, Randy. Good afternoon, members of the panel, colleagues. My question, first of all, Dr. Cummings, you mentioned that the executive committee met yesterday, but you didn't give any more details. Could you say whether any names have been put forth? Dr. Charles, you have been very vocal quite recently. Could you say whether you will be contending? And on the health side of things, should there be a cap on testing of persons across the country? I'm asking that because recently I was exposed to a scenario where someone turned up at the testing site and they were turned away because the officials thought that they did not meet the criteria for testing. So should there be on testing of persons? Could you provide some more details on the Congress that is to be held? Any names put forth as yet? Will you be contending, Dr. Charles? What will you, Dr. Cummings? Will you be contending as well? Thank you very much.
Well, thank you for that. Before we allow Dr. answer on the medical side of it, let me inform you that in an upcoming press conference, we'll deal with all things Congress. So I don't know if you hear me. So sorry about that. Yeah. Let me just say before we allow Dr. deal with the medical side of the question that we'll have a upcoming press conference. We'll deal with everything Congress. So we'll leave the questions to that press conference. I'll allow Dr. to deal with the questions on the medical side.
Thank you very much, Badri.
Please allow me to say one more.
Go ahead.
I'm sorry, please allow me to say one more. There's another scenario I was exposed to where persons who have tested positive for the virus, 14 days after they were given clearance, but they were not retested to ensure that they were cleared. So what should be done? What should be the right steps to take in that scenario?
Okay, I did mention in my opening statement about the Congress which was held. This is just a matter of keeping our constituency and persons informed of what's going on. We're an active party. Soon we'll be celebrating 64 years, so we're going strong. And so we just want to let people know that we haven't forgotten you, and we are very much alive and kicking. And so, as was mentioned before by Randy, and I think it's also mentioned in the previous press conference last week, where our chair has noted and promised that in a next press conference we'll probably direct it strictly to what's happening in our Congress. So we'll just leave that for now, but just to give you information. We're looking at, in Guyana, we have surpassed 30,186. These are persons who have been infected with the virus, are exposed, confirmed cases. And there's one move that says that when one person is infected, you multiply by 3 exponentially. So we're speaking about maybe 90 persons that you haven't come through to be tested as yet. So it's a serious scenario. New cases, 362 persons just as in yesterday, in the last 24 hours, and counting. And so for this September month, I think we've almost passed 4,000 in terms of new cases. We're looking here also at persons in the ICU, 36 cases in the ICU. We're looking at home isolation, 3,545 persons who are at home. Now, is there any contact tracing? I would recall when we were in government, we had selected places, be it hotels, be it special places, army bases, and so forth, where persons who have been exposed would have been refitted the bill, and they could have resided there and would have gotten PCR tests. So when you would have left those sites, when you go home, you know that you're walking in through your door COVID-free, you know. So we tested you, and we actually had to have 2 negative PCR tests before you move. And so we were very serious. We're talking here about 740 deaths. I mean, when are we going to move more seriously and as if we are on our marks? When there are 1,000 deaths, we can ill afford. Frank must step aside. And so we want action. Now, we're tired of rhetoric. Huh? Look at the regions. We talk about region specificity here. In Region 4, 14,382 cases. Huh? The only region that's just in 3 digits is Region 8. Huh? So the numbers are climbing, and we can ill afford deaths of our patients. We love Guyanese. We are caring government. And so we talk about the 3 W's, which we encourage our patients, our members to have. Make sure you wash your hands and sanitize if necessary. Watch your distance, watch your step, 3 feet to 6 feet as much as possible, and wear your mask correctly all the time. And then we talk about the 4 E's, where we try to engage, because as Dr. Vanders talked about public trust and public confidence. And so you have to engage. We can't take a standoff approach and a big stick approach and try to have punitive measures. We engage, we love our healthcare workers, we love our frontline workers, and so we must engage our family. We're all a big family. We must explain to them. We have to keep educating, encourage them to take the vaccines. You know, and if you know that you're immunocompromised, if you know you have comorbidities, well, speak to your doctor, speak to your nurse. You know, I know it has been said that only a few doctors, I don't know if they are at PHC, who have been assigned for you to go to. But health is decentralized, and so at the regional level, we must have some doctors there who the patients can go to and explain on a one-on-one for confidentiality. And so we engage the patients, we explain to them, we encourage them, and then at last, then you enforce the law. Then you want to, coerce if you want to be to that. But that's the last case scenario. And so we must, Mr. Anthony, we are serious. I mean, as the old people say, we're not talking with spit in our mouths now. We're asking you to step aside, simply put. So we continue to encourage vaccination, but there will be a subset of persons who may not be able to, as I said, be vaccinated, and these may include sometimes some pregnant and lactating mothers, those persons with symptoms of COVID, so you have active case. So if you're having fever, you're having the symptoms, we'll tell you, okay, wait until that will have been subsided, and then you go and take the vaccine. You don't want to take it when you have an active case. Persons who would have received convalescent plasma in hospitals. All right, we want you to wait at least for 4 to 6 weeks before you go and take the vaccine. Anyone with acute illness, we want you to build your immune system. We are saying that, of course, the vaccine alone isn't enough. You must, eat healthy and pay attention to your diet and so on. There are persons who, as I asked the question, where can you be exempted? Who gives the exemption certificate? We need to get these information. We don't know. We're just guessing. People who are immunocompromised are already alluded to persons who have had breakthrough infections, and especially those who are over 65, that the literature has shown, and those who have been immunocompromised or on immunosuppressed, those who are on blood thinners, persons with bleeding disorders, so there's some other, the list continues. So you must have to have a good patient to physician relationship. And so we want people to go to it. We want the trust to be built. We want people to have confidence in the healthcare system, which we don't have now. So, we calling on Dr. Anthony, the honorable member, to do the honorable thing by stepping aside. Thank you very much.
The issue that you raised with testing is another major issue. And the answers given by the President and Dr. Anthony are really mind-boggling. Every one of us needs to be able to know our status. And therefore, testing facilities need to be available across. There are two types of tests for diagnosis: the rapid antigen and the PCR. And those should be available across all regions, which will help the citizens, especially those who have concerns about the vaccine, to know their status. They are thinking people, they understand the guidelines, and therefore those are issues that they need to understand. We have a problem of housing density in the country. So if somebody understands clearly that they are infected, then they will then move to protect themselves, and as Dr. Cummins said, the quarantine centers that were there before the change of government are no longer there. And therefore, all of these reasons demonstrate, a plethora of reasons presented here this afternoon, demonstrate the mismanagement by Dr. Anthony and his group. And therefore we're calling on him, because he's not been able to give the answer, that Frank must go and he must step aside. Yeah.
Yeah. Thank you, Doc.
So we have, you have the taxpayer dollars which are available. You're sharing them out in terms of the grants and so forth. Well, establish the centers, use the taxpayer dollars to do exactly that, so people can know their status and have the information, and they will help themselves to make some decisions on their own. Because they're reading, they're going to the internet, they're coming to us. And so the question that you raised also in terms of the person who is positive and should have been retested, if the person is symptomatic or asymptomatic, one has to consider. But if he had a center available to him where he can walk and go and get it tested, then that question would not have arisen. So this is what we are calling for, and at least if you look at what is happening in the Americas, in the United States, Canada, and other places, then the testing is available to everyone, and they can walk in and have it and know their status.
All right, thank you, Doc. I recognize that Ms. Shamika Day would have submitted her question. Of course, that is relating to the Congress, and of course we answered that we'll have a separate press conference for that. Mr. Chabral, I saw that your hands never went down. Do you have a follow-up? And I see Wendell after that. And
They don't see me at all.
oh, sorry, Mr. Harris. Let's just confirm if Newstock has a follow-up. Wendell, and we can end with Adam Harris.
I just wanted to see if I can convince Dr. Charles to answer a couple of related questions. And also to ask you, sir, if Dr. Anthony does not resign, what then do you intend to do?
Well, we will be in the situation will worsen if the same trend continues. And therefore, the figures will speak for itself, the deaths will speak for itself, the hospitalizations will speak for itself, because all of these things are emanating from the mismanagement of the program. So you will have the data in front of you, and this is where the media steps in and informs the population even more. So, and I hope you will have access to that data, but this is why we are making a call, because this is a national security concern of ours. And therefore it has to be addressed. We are saying to him, either he steps up or step aside. Because it is obvious. We will see the hospitalizations increasing, we will see the cases increasing, we will see the deaths increasing. And we will see the overcrowding in Lilliandale.
Politically, can you do anything else? You not just call if you does not heed the call.
Well, we will take the necessary political actions as we see fit. And we have to stand up in protection of and show the leadership for the country with respect to this level of arrogance that we see being displayed by the government of such an important national security issue.
Yeah. Wendell?
Yes, thanks again. Sir, or documents, whichever, whomever, do you think that there should be closer monitoring for things that are in home isolation? And this ties back into my previous question, because I am informed through a source in Antigua that what the doctors do over there is they come to your home once you have tested positive and you are in home isolation. They come to your home and they test you before administering a clearance certificate or whatever you want to call it, yeah? So do you think that we should monitor persons who are in home isolation more closely?
Wendell, I don't know what they're doing now, but I know we did that when we were in government, as I alluded to earlier. We had a good contact tracing system. We had, in fact, a Health Emergency Operations Center. We call it HEOC. And I think all that has happened, that they have dismantled all the good work that we have done. You know, as I said before, I want to reiterate this, COVID doesn't have race, it doesn't have religion, it doesn't have, you know, all status. Persons have died. And I just want to echo the sentiments of Dr. Tedros from the World Health Organization. This is an opportune time for us to come together as one humanity, to work together, to learn together, to grow together, you know? And so the greatest drivers of COVID is a lack of solidarity and sharing, you know? Each region had committees, 10 regions, 10 committees, health emergency committee, and then we go back and share the information with the main Ministry of Health. But you remember, health is decentralized. You know, we have 10 regions and different tiers of health care. And so we had a comprehensive plan. And we have that, up to now, we still have that booklet, that National Action Plan, which all the ministries had a part of it, you know. And so we can boast, it was our brainchild, of course, the infectious hospital. Could you think what would have happened if we hadn't that infectious hospital for one moment, you know? Words are inadequate for me to describe what would have occurred. And so we don't want to go back in the past, we're going forward. So we are saying, Mr. Minister Anthony, either step up or step aside. And so we've had enough of this rhetoric. We've had enough of this. We want action now. And we want to save our people, save our lives. If we continue like this, we will have nobody to govern, because we'll kill out all our people. And so we are asking for more screening sites, more screening sites. And one of the programs I think I had with David Hines or someone, I'm asking too, in terms of the treatment. So we're looking at preventative measures as well as treatment, and then we're looking at lab. So it's the entire management, you know. So more testing, the treaties, more contact tracing, and better treatment. I even alluded to the point that we can even, because we're oil producing country, we can even have monoclonal antibodies. You know, for those persons who can't make the antibodies of their own, they're so weak and immunocompromised and so forth. And even those who have had breakthrough infections, you know. So you know, we care about our people, and we're going all lengths to look after our people.
Let me just follow on with on the issue with the issue of the regional committees. The cold chain is very, very critical. Monitoring of the cold chain in terms of the vaccines and the efficacy of the vaccines, it's vital. So this is another issue that seems to be on the wayside, because we don't really have a clear understanding of the monitoring of the cold chain at the level of when it is being distributed. And you go to the literature across, and you will see is the importance from port to patient is the maintenance of the cold chain. So yeah, these are very, and what you have suggested, Wendell, is nothing out of the norm. It's what should happen. But for some reason, Guyana seems to be a different place. And that's why our call for Dr. Anthony to step aside.
Right. And let me go to Mr. Harris, who's been waiting. We'll end with Adam.
Thanks, sir. For both Dr. Cummings and Dr. Van der Charles, it said that the greatest number of people dying from COVID are black people. The second greatest number are the Meridians. Is this true? Because these people don't comprise the largest section of the population. The other issue is, if this is so, it's responsible for those numbers. Is it that they are the largest number of people on Malitan?
Well, I haven't seen the ethnic data, but let me say to you, there are social determinants that are linked to the transmission also of the disease. If we have a country that at least we have 35% poverty, and urban poverty is very, very high, and therefore housing is presenting a problem within the urban environment where the density is high. So if you look at within the urban environment where the squatter settlements exist, the density there is very, very high. And that is predominantly within the Afro population. Likewise, we see that also that within the Amerindian population, what is happening in terms of where the housing available to them, and the number of intergenerational approach with the families would create a problem. That's why it would seem to me that in those communities, you really need to have quarantine centers where people who are infected do not go back to those homes, because then you continue to spread. So those are things, it demonstrates a lack of understanding and analysis by the present government with respect to the epidemiology of this disease, and therefore this is one of the calls that we have to make on them in terms of opening the thing up and let all of us, we are all Guyanese, we are concerned, and Frank Anthony has to either, again, we repeat, step up or move on.
Adam, also in addition to what Dr. Van der Charles would have mentioned, Guyana is information rich but data poor. We are calling on the minister to give us data. We should be able to go on the website of Ministry of Health and collect this data. data in terms of ethnicity, data in terms of the different ages, the location. I mean, it's very scanty. You put something in the papers or something, or it's very vague. You know, if you want to do any proper research, you need information. And so we're calling, we need information. And Frank must provide that kind of epidemiological data for us. And data, of course, we know, informed your decision. So if you're now looking at the data, how would you make certain decisions? And that's why we have seen the results of that. Dr. Charles spoke about the social determinants of health. That's very important. You try to be modest by saying there is structural racism in Guyana. There's inequalities, inequities, even for the vaccines distribution. There are persons who have gotten the first dose and haven't gotten the second dose. It has been alleged also, I went to Linden trying to, whip up the interest there, especially of our supporters, to encourage them to take the vaccines and so forth. And only to be heard that, okay, so many persons need the vaccines, and when the vaccine is being taken up, it's short. Not only there, persons are saying, okay, they've taken the first dose, they're still waiting. When they go back to the health center, there isn't any. So there, I don't know, in some cases, we all know the story with the Sputnik V vaccine, with the middleman and so the dishonesty, And so as a party, we are interested to speak, we want to speak to our people. And so we must, put the brunt of this sort of discrimination, this sort of mismanagement, mishandling of the COVID, where it belongs. At the feet of the box top at the minister and his team. And so we are asking once again for Minister Anthony to provide data. We are asking you to have more screening tests along the country. We should be able to walk in free of cost, especially our frontline workers and others. We need to have some better treatment, management at the COVID hospital. Woe be unto God. We have the Delta, and it was Lambda, and right through the Greek alphabet. We gone we had Lambda. We're going to Mu now, and if we consider what's going to happen, and we talk about transmissibility of these data, you carry it home to your grandmother, those who are vulnerable and so forth. So it's a sad state of affair. So they must have some sort of structural health. Overall, our health system must be overall. And so if Dr. Frank Anthony cannot, it's too much for him, you'll have to step aside. That's what we call on him, to either step aside, step up, or step aside.
Let me reassure all of you participating in this conference that this is about the protection of all Guyanese. That's why the political party, the central executive, mandated this conference to begin to look at this issue as a serious matter for the protection of all Guyanese, for the economic protection of our country. And that is why this call here today is significant, because our analysis is that the country is getting deeper and deeper into problems as a result of the mismanagement of the COVID program. And therefore, I want you, we will come again and we will have some more explanations, because we need to look at some of the other linkages in the society, as Dr. Cummins mentioned, the whole structure of the health system, to deal with some. We haven't touched on the mental health aspects and other aspects related to it. But it is a significant call on the government to be inclusive, for us to look at how our people are protected at this point in time. Without human capital, there is no development. So I want you to understand that this is not a simple political gerrymandering or anything of the sort. This is a national call by an important political party in the political landscape of this country.
Thank you, Doc. Let me say that thank you very much for your answers to the question. I just saw Mr. Chabrol's hand is still up. I know he's a very fit man. His hand has been up all press conference, but we're finished. Before we go, let me allow both Dr. Van Mischels and Dr. Cummins to say a few words about our health workers who have been working very hard and, you know, mistreated by this administration. If you can give us a final comment on the work being done by our hard-working health workers.
Absolutely, and rightly so, Randy. I mean, I just want to thank our healthcare workers for stemming the tide, for holding on there tenaciously, doing your part. You know, health, you know, not just an absence of disease, but a total well-being. And I can try to see what they're, you know, I want to empathize, I guess I can say empathy, you know, of how they're being treated, their mental health and social relationship. It must have had a bearing on them. So I just want to thank them for all the work they have been doing. And we have your back as a political party, a party of 64 years old and counting. And soon we're going to get back there and we're going to fix things in order. And we're going to model for Mr. Anthony what a healthcare system should look like. So I just want to thank my healthcare workers who have been manning the fort. My prayers are with you. I know there's inequality on mental health and social relationships. I'm calling on them to have more testing sites. I know there's still some vaccine hesitancy in you. I mean, we're going to keep talking, encouraging you. Of course, if you have other situations, try to see if you can have some healthcare worker where you can have the trust and confidence to tell them your story so that you can have maybe exemptions in some cases. But all in all, the bigger, I mean, this is a developing country, Guyana, oil-rich country now. I mean, health is not just of monetary wealth, but must include the welfare of the people, Randy.
Yeah.
You know, and our doctors and nurses are very critical to healthcare.
Yeah. Doc?
As a democracy, we want to apologize on behalf of the government for the way the health workers have been treated. And at the same time, we want to say thank you to you for what you have done in terms of protecting many of our unfortunate brothers and sisters. And we look forward to continue to work with you. And our doors are always open. Our ears are available to listen and for us to work together to take action for the improvement of the system. But we want to stand with you all, as always, as we go forward, because without you, many more will go on the wayside. And therefore, once again, thank you, and let us work in an evidence-based approach. Any concerns, we are available to hear from you, to seek clarifications, etc., as we go down the road.
Thank you, Dr. Panwas-Charles, Dr. Cummins. Thank you very much, members of the media and those persons looking at us on social media. That will bring us to the end of this first conference of the People's National Congress Reform. We want to say thank you very much and do have a safe rest of the day.